figure out what's going on with me. You know, you're talking about these shots or injections. Is that something I'm going to have to do for the rest of my life here, or is that a time thing, or, you know, I mean, how many times am I going to have to do that?
So, good question, and there's a lot of nuances to it. First off, it depends on what we're treating. So, as an example, I'll give you kind of two examples. If we are treating let's say, ligament laxity, so the ligaments around the hip joint are a little bit overstretched, maybe from injuries in the past or just generalized wear and tear on that leg compared to the other leg. If we are dealing with that and we do injections for that, we can strengthen those ligaments and tighten those ligaments up to the point where they're no longer what we call lax or loose, and therefore we don't require any additional treatments once that has been resolved. Now, our bodies, whenever they heal, it's never perfect. And anytime there is injury in one area, there's more susceptibility to injury in the future. So, and like, for example, I've injured my back pretty badly about 7 or 8 years ago. It's actually how I got into doing this type of medicine. And my back for the rest of my life will always be at a disadvantage. I will always have to take extra care of it, and I'm always prone to more injuries. Now, I've been, for the most part, pain-free since I had a conventional orthobiologic procedure. I actually had a bone marrow stem cell procedure about 4 years ago now. And I've been, for the most part, pain-free for the past 4 years. Maybe one day every 2-3 months I'll have a little bit of aching, but other than that, I don't really have any symptoms. Now, in 3 or 4 years, if my back starts to hurt again, it's not that treatment, the bone marrow treatment that I had 4 years ago, and at that point now 7 years prior, that doesn't mean that wore off or anything like that. It's just that my back's at a disadvantage and I'm always going to have to take care of it. So your hip might be that scenario where even if we get you out of pain, you're always going to have to, whether it's be preventative with physical therapy, maybe you need to tighten up your diet so it's a little bit more anti-inflammatory, less pro-inflammatory. Maybe there's certain supplements like vitamin C or an oil hyaluronic acid or fish oil that you might have to take to prevent that pain from coming back, things like that. Now, the other side of the equation, if we have something like osteoarthritis, which is obviously a disease of aging, then the aging process is always going to occur. So we can get somebody who has osteoarthritis, we can get them out of pain, but then 4 or 5 years later, the pain might come back. And again, it's not that the injections, quote unquote, wore off. It's actually more so just that we all age. And over that time period, there's going to be more aging. And so now pain might come back because the osteoarthritis is still progressing. Because none of these injections reverse and stop osteoarthritis or other degenerative processes from ever occurring in the future. They just help us to improve the state of pain, the state of inflammation, in ways that current approaches in the pain management space, such as the anti-inflammatory injections or medications, in ways that those things don't. Does that make sense?